Hello and welcome to your national TV, Doordarshan. The coronavirus pandemic has brought many changes in our lives. All that we used to do is no more the same. The new normal of wearing masks, sanitizers, and washing hands, work at home, temporary employment, homeschooling of children, lack of physical contact with other family members, friends, colleagues, public health actions such as social distancing, restrictions in movement can make people feel isolated and lonely and can increase stress and anxiety. However, these actions by the government are necessary to reduce the spread of COVID-19. But it is important that we look after our mental health. Coping stress in a healthy way will make you, the people you care about, and your community stronger. And in the hope to help us cope better, Didi Nagland is bringing you this special interview with Dr. Viketuolie, a psychiatrist by profession. Doctor, thank you for your time.
My pleasure.
And to begin with, Doctor, shall we start with your comment on the general mental health of the people in your clinical practice as observed during this pandemic of coronavirus?
This corona situation has created a lot of, generated a lot of stress and anxiety among so many people.
Correct.
Some people experience panic disorder, some people experience depression, but all related to the stress of this coronavirus and the lockdown.
So, Doctor, how do you how do pandemics generally affect the mental health of people?
As far as my observation is concerned, it is partly because of incomplete and inaccurate information leading to anxiety. Treatment nai to paile do bimar paile do muri jabo. That effect, no, incomplete and inaccurate information leading to anxiety and stress. One. Another reason is because of excessive information that we have all encountered in the first month of March and April and May. We were all bombarded with excessive news and information, which led to a lot of anxiety and stress.
Correct.
And the third reason, which I have identified, is the effect of the lockdown itself, restricting our movement, confined, 24 hours a day, 7 days a week, throughout for the last 4 or 5 months. That itself causes a lot of stress.
Correct. I remember my father-in-law saying, today is the 100th day I'm staying at home, the first time when it was started. So, doctor, what should I do if I have an existing mental health condition?
Yes, if you already have some existing mental health condition, you have to be a little more extra careful than the normal person. Like, for instance, do not expose yourself to too much information, internet, and news. They cause a lot of anxiety.
Okay.
Then avoid alcohol and drugs. They're not good. Learn to handle your stress well, and always try to stay connected with the family, stay connected with friends, even over the phone, while maintaining social distancing. And of course, try to stay as calm as possible.
Correct.
Mon aram thakibi. Paratak.
Bui na khabo lage. Acha. Doctor, how can I monitor my mental health? What's healthy and what's not? What's concerning in this situation of COVID-19?
Yes. Since this situation is creating a lot of stress and anxiety, it can cause some mental health symptoms. Like, for instance, if I'm getting a little irritable with family members, if I'm sleepless, if I'm getting restless, especially with children, restless, irritable, not sleeping well, then you could be unconsciously increasing your substance abuse. cigarette kha khan bi olop bishi excess para khabo pare modu
Pan
khan pan kha khan modu kha khan olop excess te na jani kine
Yeah, yeah.
that is a sign of being under stress which is which you need to be careful of to
Yeah.
monitor your mental health.
As doctor, what is your advice to cope with stress, anxiety, and people who are experiencing because of this pandemic?
Yeah, this is very important. For any kinds of situation like this, anxiety, stress, hodai bimar itu bimar nimite dawai bi khabara ekdom mon aram hoy jaise inaka laga dawai bi nai. You have to have some lifestyle adjustment. No. Olop ekta to be well informed. Itu corona laga information olop ki ase kinika kuribo pare treatment kiman ase thik thak para kinika hoile gao thik thak thagibo thik para if you are well informed stress to komti ho jabo de. Number 1. Number 2, regular exercise morning evening jawan hoile to khilibi itu khilibali bi na pare ajikali to at least morning walks evening walks kiba kibi rasta khan to ajikali sob khali ho jaise you have all the road to yourself alop aha ja exercise koribi to maintain your fitness. If you're fit mentally, if you're fit physically, it boosts your immune system. Number 3, sleep well. Ajikali bishi manu balpara nagoma ho jaise because of stress and anxiety. Itu nimite sleeping well will boost your immune system and it relieves your anxiety and stress.
Okay.
Then 4th thing, you stay connected with the family, stay connected with your friends even over the phone. No, it's ajikali to so phone pare bi pare ase but it is important share your anxieties and your worries whatever things that comes to your mind you share with your friends. Mon to bishi aram ahi jabo. Then practice deep breathing exercise. Mon bishi chinta hoile stress bishi hoile we encourage our patient to do this breathing exercise. Ine mon bon suku bon kore kine nak para sas lobo hold koribo aru release koribo. So you do that for 10 minutes 15 minutes beshi aram hoy jabo apna laga stress bi gumabi gumobole mon ahi jabo aru stress bi beshi komti ho jabo. Aru another thing that you need to keep in mind to deal with the stress of this COVID virus is maintain a peaceful family environment. Very important. Family te conflict thagile to bas hoise stress bahar de family te bi stress bishi hole to mental health nimite bal nai. Itu nimite bahar de stress bishi thagile bi ekon hoy family te relationship mota mai ki bitor de more parents khan bacha khan mili kine khushi thagine thakile to stress aru sob pahori jabo so melt dissolve ho jaise. So maintain this and avoid excessive use of mobile phone. It will be stress generate kore ase de.
Paka. So dear viewers, it is very important to note so many things that our doctor here is telling us. Holibi ekta mon de catch kura aro apnar ke aro reinforce kurubulo mon thaka do bishi ase mohan kuri kine healthy thakibole paribo aro khushi para thakibole paribo bui na khai kine thakibole paribo. Ekta sobse important ekta do family khushi thakibole lagibo family milli kine thakibole lagibo tenega hoy kine thakise gole do mon duk bi dur bimar bui tu bi dur enega hoy kine healthy hoy kine corona do overcome krubo corona do face kurubole paribo enega doctor bra janai dia ase itu point aro jor bra duribi koi kine itu janai dia ase doctor aro ekta kobole mon thaga do moi bi corona lagi bole bui lage aro more laga family more la near and dear ones ta hangi bi corona lagai dibole bui lage ki kurile bal hobo ho itu chinta bra
khali apni nohai moi bi boy lagi ase corona duribole ekta do so alop kiba kibi precaution to lobo lage ekta precaution to bishi manu thakya jaga marketplace or say meeting itu kan to parata komti jaga komti kuribe tate.
Uh-huh.
Avoid crowded place. Number 2, avoid unnecessary socializing.
খুলি দিছে
একদম
কইনে
হয় খুলি দিছে হৈ কিনে একদম ইয়াতে তাতে বেৰা চুৰু হইলে তো ইটো পাবলে চান্স বেছি আছে দে
আচ্ছা
তো পাৰাত তাক ইটো unnecessary socializing to কমতি কৰিব লাগে. And the third thing, you have to practice the guidelines. Mask tolabi, হাত সদায় বাহাৰে যাই কিনে গড আহিলে তো দুলাবি, social distancing অলপ ইমান ওচৰতে লগতে মানুহ লগতে নাথাকিবি, এইটো কাৰণে অলপ গাইডলাইনছ অলপ ঠিক ঠাক পৰা এতিয়াতো ডেইলি লাইফ ষ্টাইলতে প্ৰেক্টিছ কৰিব লাগে. এইটো কাৰণে ঠিক ঠাক থাকিলেতো দৌৰিবলৈ চান্স বেছি কমতি আছে এতিয়া.
আচ্ছা চ' এতিয়া জনাই দিছে মহান মন দুখ আছে নিজৰ বি লাগিবলৈ বই নিজৰ গড় মানুহখানকে বি লগাই দিবলৈ বই হ'লে বি এইটো বই আছে গৈ কিনেতো লকডাউন আনলক 4 শুৰু হৈছে গৈ কিনে মহান বিৰাবলৈ যাব এতিয়াতো পাৰ্টি কৰিবলৈ পাৰিব না না গ্ৰীনে বিৰাজ শুৰু হৈছে গ'লেতো চিন্তাটো তাতেহে খতম. আপুনি পাৰ্টি কৰিব নহ'লে বি মাছ গেদাৰিংতে যাব, গভৰ্ণমেণ্ট পৰা SOP দিয়াটো ফ'ল' নকৰিব, মাছ ঠিক পৰা নালাগাব, হেণ্ড চেনিটাইজাৰ নচলাব, হাত নধুলাব, এনে কৰি কিনে পইলা পুৰণা ষ্টাইলতে বিৰাজ ষ্টাৰ্ট হৈছে গ'লেতো হয় চিন্তা কৰিবলৈ লাগে. হ'লে বি এইটো খান জানি লৈছে গ'লে আৰু এইটো প্ৰেক্টিছ কৰিলে অকো বহি নাই. একটা কনচাৰ্ণটো কি টাইম দে হ'লে বি চেনিটাইজাৰ কৰিব না আৰু কেতিয়া গড় পঞ্চিব হাত ধুলাব কিবা চুব হাত চেনিটাইজাৰ এইটো চব মানুহ মই নিজৰ বি এনেকা আদত শুৰু হৈ যাইছে এতিয়াতো আৰু মই বি দেখি আছে দুসৰা মানুহ বি how can we abstain or how can we not be so obsessive about this hand sanitizing and hand washing, doctor? কি কৰিব?
If you have been practicing hand washing every time before COVID-19, we will say, hey, obsessive compulsive disorder আছে দেই, obsession আছে দেই, itu be mental bimar আছে এনেকা কৈ দ OCD কৈ দ it's an obsession. হলি বি this COVID-19 says সদায় হাত ধুলাব লাগে, সদায় sanitize কৰিব লাগে. So now frequent hand washing has become an normal obsession. So there's nothing mental about it now.
Okay, that's
it's
great
normal.
news. Great news for me.
At least for the next 1-2 years.
Hopefully. Maybe more hygiene be bal hoga. Yeah. So doctor, how do I offer emotional support to friends, family, co-workers who are being quarantined?
It's very important that we do not stigmatize them.
Okay.
Very important. This disease, COVID-19, is highly stigmatized. একজন বিমার ধরিছে হলে তো পাস সো ইটো একদম হাওয়া তো একদম জলদি যায় সব মানুহ বি ভিলিফাইড ডেমোনাইজড বিয়া মানুহ বানাই দিছে মিডিয়া পৰা. So we should not stigmatize it. All of us are vulnerable. আপনি বি পাব পাৰে, মই বি পাব পাৰে, বই নালাগিবি একো নহয় হৈ যাব এনেকা কবি. Do not stigmatize it. Tell them সব মানুহ দৌৰিলে তো একবাৰ তো কোৱাৰেণ্টাইনতে বহিব লাগে, উপায় নাই, এইটোতো গাইডলাইনছ লগা ৰুল আছে. প্ৰাইম মিনিষ্টাৰ হ'লে বি বহিব লাগে, মই চকীদাৰ হ'লে বি বহিব লাগে, মই ডক্টৰখন বি বহি আছে, একবাৰ এক্সপ'জ হ'লে কোৱাৰেণ্টাইনতে বহি আছে, এইটো বুজিব লাগে. So that also will reduce the stress নে. Then কবি সব মানুহ বি এইটো দুৰীয়াখানটো নামৰিব, খালি কোনোবা কমপ্লিকেশ্যন কিবা থাকিলে মৰিব. তো এইটো নিমিত্তে বই নাখাবি একো নহয়, we are all with you. এইটো বি একটা পইণ্ট. আৰু দুসৰা পইণ্টটো তাই লগা কি কি নিডছ আছে, পাৰ্চনেল নিডছ না, স্পিৰিচুৱেল নিডছ, মৰেল ছাপৰ্ট, চব আপুনি মেক শ্যোৰ ডেট হি গেটছ ইট. তো এনেকুৱা হ'লে তাই লগা মন বেছি আৰাম হৈ যাব.
আচ্ছা ডক্টৰ মোহন, এতিয়া চব আডাল্ট খান লগা হিচাপতে কথা কৈ আছে, হ'লে যদি মোৰ বাচ্চা খান না মহান সব গড়ে বাচ্চা খান থাকে, তো বাচ্চা খানকে করোনা ভাইরাস লগা কথা কোৱাটো তা খানকে বই নেখেলাই কিনে কেনেকা সমঝাব?
এইটো ভেৰি ইম্পৰ্টেণ্ট. মই খান সব নিজৰ লগা ফেমিলি এক্সপিৰিয়েঞ্চ দ এজ এ পেৰেণ্ট. ফেমিলি পেৰেণ্ট লগা ৰিয়েকশ্যন এফেক্টছ আৱাৰ চিলড্ৰেন. মই খান বই খাইছে চিন্তা হৈছে হ'লে তো বাচ্চা খান বি লাগি যায় দেই, chinta ho jai de
Pakka.
itu ni it's very important for parents to stay calm boina khabi akuno hoy ho jabo aram thagibi when you stay calm children also stay calm de it speaks volumes bishina kwelibi tate your model will affect your calmness peacefulness will affect the family atmosphere number 1 number 2 tell your children accurate information ho jabo corona do hoilibi akuno hoy bacha khan to less danger danger do dangor elderly khan hi ase nega balpara information di dibi dawai bi khabale kiba kibi bishi ase akuno hoy balpara thik thak bal khabi thik thak gumabi balpara gumabi itu kan balpara advice dibi na to nega hoile to bacha khan to tai khan laga anxiety stress to bishi komti ho jabo
Doctor, school be born, colleges can be born. Aro itia do home schooling he chuli ase, online schooling he chuli ase. Itu temte ama baba laga role do. Ama baba akla no hoy. Kokai buini kan be. Sub adults kan, dangor kan laga role, bacha kan ke school itia born hua do tahan ke kenega prepare kurigine tahan ke positively thakibole dibole paribo aro school khulise gole school jadam de ki kuribole lagibo aro itia do nutun hobo to apnar la advice ki hobo apnar la comment
yeah it's very important especially with children no children are used to a very active physical life hodai bahar te khilibo birabo polabo itia ekdam achanak para 24 hours a day bon kora to ekdam restless ho ase restless listless irritable sleepless these are not healthy for the mind no itini mide ekta to school bi nai ita to homework dibi assignment dibi kiba kibi kuribole dibi itia to online laga class bi shuru hoi jaise that is a good thing besides online give them assignment things to do help them to learn new skills daily kiba kibi gor laga kam modot kuribole dibi na plus if possible provide them some space to play
hoido na
music play aro ide rasta debi birabole debi I advise my children to play in the streets the streets are all empty now so this is how we can encourage them to let go of the energy energy bi ekdam suppress kudile to not good for the mind de
so itia ekta idu reinforce kuri dibolo mon thaga do ama baba parents khan aro tate kokai khan didi khan thaga khan do bacha khan ge sob ke pandigine rakhi dibo etu no hoy bacha doctor ko anisna khilia laga time ase khilia laga time de taike khilibole ne degine pandigine rakhi dise gole do upai na hoy jay na etu garne etu bal hobole thaga bi biya ho jabo etu garne khilibole bi dibi puri bole dia dam de ekta important thing jane bola laga do notun skills school laga textbook school laga assignment sa kuri thakile to tired ho jabo moi bi tired ho jabo etu garne notun khilibole notun hikibole dibi art painting kan kurubole dibi god jaru maribole hikibole dibi baat banabole hikibole dibi dal banabole hikibole dibi etu kan sob aro doctor kwan is na beshi important bahar de rasta to khali ase to etu ane bahar de boi lage koina pandi kine na rakhibi bahar de jagina maintain physical distance mask kan lagabi bahar de jagina sky man sundur ase to sai sabi na etu beshi important ase doctor aro ekta now what is your advice to frontline healthcare workers who are stressed, fear, anxiety, overwhelmed with duties, particularly those areas with high incidence of corona cases? What is your advice?
Yeah, apni bishi dangor question hudi ase. There are 3 departments Nagaland bishi overworked hua ajikali ekta to medical ase ekdam front line te ase covid virus logate ekta to police department khan bi bishi overworked hua ase aro ekta to administration tai kan tinta department to alop overworked hua ase so what I have been noticing is they need to be careful about a mental condition known as burnout. Itu alop excess kam bishi jor para ineka stressful laga kam hodai kuri thage inika hole we burn out.
Yeah.
So we have to be careful about that. Burnout kinika para janibo ekta sign to.
Acha.
One sign of being burned out is alop fatigue, mental fatigue. Alchi lagi jabo. WhatsApp te bhi sabale mon alchi lagi jabo. Puri bole alchi lagi jabo. Ekdam kiba kibi kuri bole ekdam alchi. Your mind is tired. So mental fatigue is one sign. The other sign is sleepless. Ekdam rati guma bhi alop digdar pai jabo. Another sign of being burned out is indifference or insensitive to your surroundings. Ekdam manukhan kotha ko ase hili ase program kore ase hole ekdam uninterested ho jabo, unconcerned ho jabo. Low motivation. Kiba kibi kuribole drive to energy na thakibo. So these are signs of burnout. So we need to be careful about this. Very, very important. In fact, some of them could already be going through this experience.
I'm sure. I'm sure.
Yeah. So that is the sign that you have to look out for burnout.
Okay.
So another thing that they need to be very careful these days is learn to balance between work, rest, and sleep.
Balance between work, rest, and sleep. Yes.
God has given us 24 hours in a day. 8 hours for work, 8 hours to sleep, 8 hours to rest. Khana khalwa, kotha koa, socializing, a lot of recreational activity. Thik thak para balance koribe. Beshi overwork korikene sleep compromise hole to mental problem ulabo de. Itu nimite balance between work, kam bhi koribo lage to. Holibi rest bhi koribo lage. Aro rati hole to bal para gumabo lage de. Then the next morning if you feel if you have had 7-8 hours of good sleep, next morning ta ekdam refreshed, aram, takot.
Just. So all the frontline workers, the health care workers, the administration, the police, and as the media reports shows, we all seem to see a stress, all seem to see that this coronavirus has taken its toll on all of us, not only the public. And the most is the healthcare workers. But we here at Doordarshan Nagaland, we want to salute all the frontline workers and thank you for your continuous effort to contain this disease. Doctor, one last question that I want to ask is, what can older adults with comorbidities do to reduce emotional stress and anxiety?
Yeah, it will be a very important question. Corona nimite manu muria bi bishi muria se do. Sob manu na muribo akuno hai. Jawan Khan, Bacha Khan, bishi manu na muribo. Muria Khan to elderly people, bura buri Khan, 60 plus hua Khan. Itu comorbidities moi kan medical te ineka koi. Itu Khan to ine kotha if you have already chini bimar, diabetes, if you have blood pressure, if you have some heart disease or lung disease, ineka hoile to aru iti upor de aru corona dhurishe hoile ar moribole chance olop bishi ase. Itu nimite ta khan to olop itu hoshe koriba lage. So what I will advise is nobody can prevent the virus. All of us are vulnerable and any one of us can get the virus. Itu nimite olop gao to fitness tik thak thakibo lage. I always insist on exercise and fitness. Olop exercise to koribi.
Acha.
Bura buri hole to khilibole na pare. Hole bi morning evening te bi walks paribo to. Gardening koribo paribo to. Kiba kibi korigine olop gao to tik thak thakibole dibi. Fitness, a good strong fit body will boost your immune system. Number one. Number two, khalwa. Itu olop thik thak para khabo lage. Proteins especially. Proteins mane meat একদম বেছি বি নাখাব লাগে
আৰু
অলপ
BP উঠি যাব।
বেলেঞ্চ কৰি কিনে খোৱা লোৱাটো ঠিক ঠাক পাৰা খাব লাগে প্ৰটিনছ ঠিক ঠাক পাৰা খাব লাগে বিকজ প্ৰটিনছ বিল্ডছ ইয়ৰ ইমিউন চিষ্টেম দেই এইটো নিমিত্তে নম্বৰ 1 নম্বৰ 2 ফ্ৰুটছতে স্পেচিয়েল ভিটামিন আছে ভাইৰাছকে বনাই দিবলৈ এইটো স্পেচিয়েল ভিটামিন খান টেঙা খান আজিকালি ছিজন হৈ আছে মেংগো খাব পাৰে আনাৰস খাব পাৰে বানানা খাব পাৰে এপল খাব পাৰে এনি ফ্ৰুটছ ইট এজ মাছ এজ পচিবল বাহাৰ পৰা ভিটামিন নাকিনিলে এনে এইটো খান পাৰা খাই আছে হ'লেতো এইটো পাৰে বি কামটো আহি যাব ফ্ৰেছ ভিটামিনছ দেন thirdly you can supplement your diet with by taking vitamin C and vitamin D বুঢ়া বুঢ়ী খান হ'লেতো এইটো খান বি খাইলে তাখান নিমিতে বেছি ভাল হ'ব আৰু পাৰা তাক sleep well rest your body and sleep well and stay connected with the family মই খান লগা ফেমিলি হ'লেতো নাগা মানুহ ফেমিলিটো আমেৰিকান নিচিনা নহয় আমেৰিকা হ'লেতো আলাগ আলাগ হৈ যায় তো বুঢ়া বুঢ়ী খান একলা একলাই থাকে ছাপোৰ্ট নাই তো এইটো নিমিত্তে আমেৰিকাতে মানুহ মৰিয়াতো বেছিজন এল্ডাৰলি খান বেছি মৰি আছে বিকজ অফ দিছ ফেক্টৰ্ছ হ'লে বি নাগা মানুহ হ'লেতো উই আৰ ছ'চিয়েলি ভেৰি cohesive very strong family system এইটো পৰা মই লগা হিচাপ হ'লেতো বেছিজন দূৰিলে বি ইমানজন নমৰিব নেকি
ডক্টৰ আপুনি আহি কিনে মহাংকে ইমান ভাল ভাল কথা কৈ দিয়াৰ কাৰণে বেছি থেংকছ
Okay, thank you.
Well, it seems there are a lot of things that we can do to look after our mental health and help others who may need some extra care and support. Some quick tips could be keep informed, have a routine, minimize unnecessary news feeds, maintain social contacts virtually, stop alcohol or drug use. If on treatment, find ways to continue the therapy. Be conscious and be in control of your screen time. Help others, support healthcare workers, and use your social media to promote positive and hopeful stories. Remember to correct misinformation wherever you come across any or stop sharing. Fear is a normal reaction in situations of uncertainty, but sometimes fear is expressed in ways which are hurtful to people. Remember, be kind. Don't discriminate because of your fears. Respect and be grateful to the healthcare workers. COVID-19 is a global pandemic. Do not attribute it to any specific group. Thank you all. Stay safe, stay protected. Thank you, Doctor.
Welcome.